It's not just the fall season, but it's also open enrollment season, and changes are coming to health insurance, which is why we have Mike Guerrieri kind of breaking it all down, and he's here with Health Markets Insurance Agency to really help us. How's it going?
It's going great.
Yes, well, welcome into Studio 10. We definitely need you because with it being election year, things like Medicare are kind of hot political talking points. So we need to know, what are the changes coming to Medicare this year?
Yeah, so this year in my 23-year career, we're seeing the biggest change that I have ever witnessed. And it's going to be across the board because it's a governmental change, part of the Inflation Reduction Act. And really what's happening at its core is Part D plans, which are called prescription drug plans. They're having the elimination of the donut hole. And what that means is that finally there will be an out-of-pocket maximum for people's prescription drugs.
That sounds like good news. So what is that out-of-pocket maximum?
Yeah, so what's going to happen is as long as the drugs are on your plan's formulary, you will pay no more than $2,000 a year for your medicine, which sounds like a great thing.
Right.
But of course, whenever there's a good, there has to be a consequence.
Yeah, so let's talk about those negative consequences. Does that mean there's more expensive plans?
Unfortunately, whenever the government makes the insurance company do something, what's the insurance company going to do? They're going to pass it along to you in regards to higher premiums. And for this year, we're seeing plans that are going to increase by 200%, 300%. Some plans are even going up by as much as 600% when it comes to the drug coverage.
Wow. Okay. So, and this is industry-wide?
Yeah. And so people will be impacted in one of two different ways. If you have a standalone drug plan, that's where you're going to see these rate increases, or the insurance companies are going to strip back the list of meds that are going to be covered. But for those who have Medicare Advantage plans, they will see a decrease in coverage in other areas. They might strip back a little bit of dental, pull back some vision. So everyone this year needs to shop, and it's anticipated that 85% of Medicare beneficiaries are going to be looking for a new plan this year.
Wow. So when you were talking about major change, that's like an understatement. This is huge. So are there any other changes that we should know about going into the season?
There actually is another one that's really nice, and it's what's called an M3P. No, we're not talking about digital musical files here, but M3P is the Medicare Prescription Payment Plan.
Okay.
And what that means is if you, at the beginning of the year, have to meet your deductible and you have some large co-pays, you can actually take that large out-of-pocket expense that you have and break it up into smaller monthly premiums throughout the year. And what's important to know is there will be no interest, no penalties. So for people on a fixed income, they won't have to pay that large dollar amount all at once at the beginning of the year.
Okay, so yeah, those that are on a fixed kind of budget will, I'm sure, appreciate that, but are there any limitations?
Well, they just have to make sure that they institute the M3P through the insurance company.
Okay.
So you can't go to the pharmacy and expect that they're going to know about it. You need to make sure you pick up the phone and call the actual insurance company, but that's really the only limitation. The other limitation I want to make sure that we reference back to, though, is in regards to the drug out of pocket. It needs to be on your formulary, which means that it's an approved drug, right? If the insurance company doesn't cover your med at all, it's not going to count towards your $2,000 max.
You know, you mentioned the importance of shopping plans. So what are some of those dates that people need to know about shopping?
Yeah, so we're now in the enrollment period. So enrollment period started on October 15th, but it's a short window. It ends on December 7th. So people really need to get out there and do their due diligence now because plans have to not only be enrolled, but the paperwork has to be in the insurance company's hands by December 15th. So we strongly encourage everyone to get out there as soon as possible because we know there's going to be so many people shopping. Don't wait till the last minute to do your shopping because you might get shut out.
Oh, absolutely. And I know, too, that people are going to want to research and find what works for them. I want to remind people, too, that you will be able to assist in that research and do it at no cost, correct?
Yeah, at Health Markets, we work with over 250 different insurance companies. We are going to do the research. We're going to help you do the investigation. We're going to keep you in the best plan year after year after year. And I really, really want to stress, like you said, we do it at no charge. So enlist a professional. Don't do it all on your own and wonder if you're in the right plan.
Right.
We'll do it all for you at no cost.
Yeah, and it seems like you're able just to have that communication, talking through and making people feel comfortable because this is a big deal.
Oh.
And it impacts you so much. So it's so nice that, you are there kind of like a part of their family making these big decisions. So of course, if people want to reach out, what's the best way to do that?
Yeah, there's two ways to do so. You can reach us on the internet through our website, which is just healthmarketsdetroit.com, or you can call us 734-252-0064. You'll be routed to one of our office staff who can get an appointment for you to where we'll set up that one-on-one consultation. We'll do it face-to-face. We'll do it over the phone. We'll do it over Zoom. We'll do it early in the morning, late in the day, whatever is convenient for you. We will make sure that we find time to get you in the right plan for your situation.
Yes, well, thank you so much for all of that, and all that information, of course, will be on your screen, so you can reach out and make these decisions sooner than later. We don't want to procrastinate with something like this, but thank you so much for breaking it all down, because I think sometimes people see the word Medicare and see changes, it can be overwhelming, but you really broke it down and helped us, and knowing that this is just the first step to helping more people battle these changes. So thank you.
Glad to help.